The story of Virginia Garcia really starts in 1975 with a tragedy. Virginia Garcia, a young migrant farm worker child, had a cut on her foot. They were in a migrant camp that was isolated. Unfortunately, the infection did get worse and led to her death. That was the catalyst that really caused the community leaders to act and begin the first Virginia Garcia clinic. The mission of Virginia Garcia is to provide high-quality, culturally appropriate services in Washington and Yamhill counties with focus on those who have barriers to care, including migrant seasonal farm workers. We are excited about going back to delivering primary care, reestablish some of those services that were put on hold during the pandemic.
As a community health center, we are not immune from workforce shortages. That has a direct impact on our patients and their ability to access the care that they need. Virginia Garcia has been exploring ways to help recruit, retain, and support staff. One area that we hear from our staff is the desire for professional development and learning opportunities. We have developed a partnership with NEMA, the National Institute for Medical Assistant Advancement, to develop our own MA program. So we host medical assistant learning in clinic, and we partner with NEMA to provide the classroom content virtually. And there's even more opportunity on the horizon, recruiting our staff, our patients, and our community members to be the employees we really need in the future.
The 7th Avenue location is going to serve as an access point for COVID vaccinations, COVID tests, and COVID treatment, serving the general community instead of just our patients. Additionally, we're going to use that site to help re-engage patients that haven't been able to access our services and also bring in new patients. Because of COVID, how we do primary care is going to look different. One main way it's going to look different is because we got really good at doing telephone and video visits. We can now weave that into how we provide services, doing work that's going to improve the health, improve the well-being of our patients.
We've seen the increased need for mental health services go up across the community for many reasons. We have a strong integrated behavioral health program that embeds mental health professionals within our primary care setting and allows us to address mental health, substance use, and physical health needs of our patient population. With the program of enhanced care management, we're really leveraging not only mental health expertise, but our social care navigators to take lived experience from within the community and engage patient care in a different way that meets these patients' needs right where they're at in the moment. Without a social care navigator, we wouldn't be able to bridge that world.
I enjoy being with the patients most of all. That's why I went into nursing. For me, when I see their faces, when they're telling me that what we talked about in the last visit, they took to heart and made those changes, that creates a ripple effect. That change now goes to their children, trickles down to their grandchildren. That one-on-one conversation where you were able to relate, you were able to understand. There's no feeling greater than that.
The Newberg Clinic expansion will allow us to double our capacity for medical services, for dental services, pharmacy, and then bring to Newberg services that we have at our other sites. I believe that the Newberg Wellness Center project is something everyone's going to feel good about supporting. It's going to address health equity, ensure that services are culturally appropriate, and is really going to be an amazing asset to the community.
There's a culture and a community here that is like no other workplace. You have people passionately engaged and committed to ensuring that we can address some of these health disparities. I've seen a lot of change over the years. We've seen a lot of hardship over the years, but we come out progressively innovating, and that allows me to believe that we're going to be able to do something great.